Thank you. Oh, we've still got somebody coming in, so we'll admit them as well. Brilliant. Okay. Well, thank you very much, everybody, for attending today. The reason we hold these meetings is to go over the most recent guidance that has been sent to us from usually Department of Health and Social Care, and there have been quite a few changes, as you'll all be aware. So what we wanted to do today is just go over some of those changes with you and then take any questions that you might have. So we haven't got an agenda because we kept this meeting specifically for the updated guidance that we were awaiting. If you remember last time, some of the questions that were coming out were about, do we have to test? What's the rules on isolation, etc. And so we are now up to date with the new guidance on all of those areas within social care. So today I've also got with me, we've got quite a lot more coming in. Welcome everybody. I'm just explaining what the meeting is about. We've also got here today, I notice in the chat, in the people that are here today, we've got Judy from the CCG, and we've got Irene as well from Public Health as well. So thank you very much for attending both as well. And I may well call on you, Irene and and Judy, just to clarify some issues if we have them. So thank you very much. Okay, so you will probably have all received the e-bulletin and be aware of all the guidance, and I believe there's been a letter sent out as well from Norfolk County Council as well about the main changes that have occurred in the last week. The big issues are infection prevention and control in adult social care settings. So what I'm going to do is just talk you through the changes. And then after I've talked you through the changes, I will go and see what's in the chat box, and we can answer some of the questions or put them to whoever needs to answer them if we can't. So if that's okay with everybody, I'm just going to go through them. So firstly, the infection prevention and control in adult social care settings, the supplement. This applied from the 4th of April, unless within there were different dates, but largely it was from the 4th of April. The supplement is designed to augment that general IPC guidance and outline measures providers should take in the face of COVID-19. And the guidance itself is made up of two documents and is an attempt to consolidate those documents into one COVID guidance document. So there is, and I think you'll be able to pop this up, Megan, there is the supplement, and then there is the summary of the various changes to COVID guidance for adult social care providers.
I've popped the guidance in, and Irene has really kindly as well popped in some key changes, which is really helpful, but I'll pop in everything else as well.
Yeah, so I'm going to go through some of those key changes as well. So both documents, to bear in mind, should also be read closely with the testing guidance as well. So in summary, the COVID supplement and the guidance summary make the following changes. So the first one is around asymptomatic testing. As you'll all be aware by now, testing has changed. So testing is now for all staff in social care. It's for 2 LFD tests per week, taken before they begin work, 3 or 4 days apart. The only difference to that is if you are part of what's called the Vivaldi study, which is a study that's looking into care homes and infection and the spread of the virus. They're doing lots of research around that, but you have to be part of that study. And they will be doing additional asymptomatic testing, but you'd know if you're part of that Vivaldi study. Also, the only time it wouldn't count is if you have a positive case, either a resident or staff, and staff in care homes, and high risk. The definition for high risk is in that testing guidance summary, and that includes extra care, supported living settings that should do daily testing for 5 days. So that's high risk, and it tells you the definitions around that. Only those working in the settings in that period need to test. You do not need to bring people into work or on their non-working days to test. And there is no longer any regular asymptomatic testing for people receiving care. So in other words, your residents do not need to test if they're asymptomatic. And staff who are contacts of a positive case, can you remember, you had all the rules around positive cases and contacts, they do not need to isolate or test. For symptomatic testing for staff, if they develop COVID symptoms, they should take 2 LFT tests 48 hours apart from one another, and symptomatic staff should stay away from work, conduct the tests at home, but can return if both LFD tests are negative. This includes paid members of staff or volunteers that are regularly in a care setting. It also includes cleaners, catering, support staff, etc., regularly in care settings. And again, it explains it more in the guidance. There is a guidance on how to end isolation also in the guidance, which we'll touch on. Staff who are contacts of a positive case or someone who is symptomatic do not need to test or isolate. So it goes on to social care staff who test positive. So what should they do? They should stay at home until they've had 2 consecutive negative LFD tests, taken 24 hours apart, at the earliest from day 5 and 6. Day 0 is the day they test positive and first develop symptoms. If a staff member's LFD result remains positive on the 10th day, they should continue to take that LFD test until they get a single negative result. If the staff member continues to test positive on day 14, they can stop testing and return to work on day 15. So that is a key change. Symptomatic testing for people receiving care, and that excludes care home residents. People who receive care who are symptomatic are advised to take 2 LFD tests 48 hours apart from one another. If they test as soon as they develop the symptoms, they can stop self-isolating if both LFD tests are negative. If they test positive, they should be encouraged to follow the advice for the general population, which is to stay at home, avoid contact with others. They can end isolation early if they have 2 LFD results taken 24 hours apart at the earliest from days 5 and 6. If a care home resident is symptomatic, tests positive, or is a contact of someone with COVID-19, what should you do? Care home residents who have symptoms of COVID-19 should isolate and take 2 LFDs 48 hours apart. They can stop isolating if both tests are negative. If positive, isolate until they've had 2 consecutive LFD results taken 24 hours apart at the earliest from days 5 and 6. Day 0 is the day they test positive or first develop symptoms. If they continue to receive positive results up to day 10, they can stop isolating after day 10. If any individual who is unable to test should isolate for the full 10 days. Residents who are close contacts of COVID-19 case do not need to isolate or test. Regular asymptomatic testing for people who receive care and support. There is no longer any regular asymptomatic testing for people receiving care and support. So again, that's the residents. Discharge from hospital into a care home, and this applied from the 1st of April. People who test positive prior to discharge can be admitted to a care home if the care home is satisfied that they can be cared for safely. A person will receive a PCR test prior to discharge or an LFD if they have tested positive in the last 90 days. This means the designated settings are no longer in force, so we don't have those step-down facilities. Care home residents should not be required to self-isolate when discharged back to the care home following admission into hospital, subject to a negative PCR or LFD test. Residents still will need to self-isolate for 10 days if they've been discharged from part of a hospital where there's an active outbreak. They can end this isolation early by having 2 negative LFD tests 24 hours apart from days 5 and 6 onwards. Admission to a care home from the community or another care setting. Residents admitted from the community or another care setting should take a PCR test within 72 hours before they are admitted, or an LFD if they have tested positive in the previous 90 days, remembering that issue of PCRs having residue virus in them, and an LFD on the day of admission. These tests should be provided by the home. If the individual tests positive on either of these tests and continues to be admitted, they should be isolated on arrival, and then you go back to the rules of ending isolation that were discussed before. Visiting arrangements in care homes, and this is again something that people were asking a lot of questions about. There should not normally be any restrictions to visits in or out of care homes, including the number of visits. The term essential caregiver appears to have been removed. Instead, the guidance now talks about all care home residents having one visitor who can visit in all circumstances, including during periods of isolation and outbreak. Our understanding through meetings with NCF, but also other groups, is that there is no limit on the number of visitors when there are no restrictions due to outbreaks or isolation. End of life visits should always be facilitated. Only visitors providing personal care, and again, that's what they used to call the essential caregivers, should test before visiting. So remember, anybody that's a visitor that is providing personal care should still test before visiting. They will not need to test more than twice a week. Other visitors not providing personal care no longer need to test. NHS staff should be able to provide evidence of negative tests within the last 72 hours on entry, and there are testing guidance for professional visitors as well. CQC inspectors should test before their inspection up to a maximum of twice a week if they are in a care setting, 2 times or more per week. Other visiting professionals should be tested with tests provided by the care home if they are providing personal care. So note, other visiting professionals, not NHS staff, that should have access to their own testing. Other visiting professionals should be tested with tests provided by the care home if they are providing personal care as per the guidance for visitors providing personal care. Care home residents should only self-isolate if they test positive for COVID-19 or if they are admitted from hospital where there is an active outbreak. Visitors are still expected to wear face masks but it is acknowledged that in some circumstances this might not be appropriate. Additional PPE may be appropriate for visitors providing personal care. PPE. Staff should only use FFP3 masks when carrying out an AGP on someone who is suspected or confirmed to be COVID-19 positive or who has another infection that could spread by the droplet or aerosol routes. Where no infection is suspected or confirmed, a type 11R mask or IR can be used for those procedures. Staff should wear that type of mask and eye protection, apron and gloves when giving personal care to someone suspected or confirmed to have COVID-19 or when cleaning their room. When undertaking other staff tasks within 2 meters of someone suspected or confirmed of COVID-19, a type IAR mask and eye protection should be worn. An apron and gloves should also be worn if it's risk assessed that contact with bloody or body fluids is likely. When carrying out personal care or other tasks involving likely contact with blood or bloody fluids for someone who is not suspected or confirmed to have COVID-19 or type 1, 2, 3, type 1, 2 or IIR masks should be worn along with an apron and gloves. Eye protection should also be worn if risk assessed that splashing is likely. The COVID-19 supplement has more details on the use of PPE and sessional use where appropriate, so always refer to that. Management of waste contaminated with respiratory secretions or mucus from a person from COVID-19. In a person's own home, this waste should be disposed of in the domestic waste stream with no extra measures needed. I think that's something that's changed as well. Staff movement. Care homes are no longer required to limit staff movement between sites or services, but the guidance does give the local DPH, the Public Health, Department of Public Health, or Health or HPT teams the power to limit staff movement if the local prevalence is high. So you would be, or we as a system would be told if that's the case. And those are those health protection teams that would tell us. COVID-19 testing in adult social care. So again, just to refer to the guidance, look at that guidance. It refers to all care homes, home care, extra care and supported housing and supported living, adult day centres, personal assistants, shared lives carers and social workers. And you should get free testing and that should be available for all of those settings. There is advice on how to get it. There's the bulk of the testing guidance gives that I've discussed was in that summary. Rapid response testing in care homes and high risk extra care and supported living settings. If an individual receives a positive result in a care home or a high risk extra care and supported living setting, then all staff should conduct rapid LFD testing every day that they are working for 5 days. Only staff working in the setting over that period need to test. The testing guidance adds day centres to the list of settings where this applies, but just to be aware that we're just trying to check if that's accurate, because it seems it isn't clear in other documents. So just to be aware of that. Outbreak testing in care homes. The definition remains 2 or more positive or clinically suspected linked cases of COVID-19 that occur in the same setting within a 14-day period. This applies to both staff and residents and includes PCR and LFD results. If advised, the whole home outbreak testing will be initiated, and that will follow as in the guidance. So it says all staff and residents should conduct LFD and PCR tests on day 1 of the outbreak and another LFD and PCR test between days 4 and 7. After the first week is completed, staff should continue to regular twice weekly asymptomatic LFD testing, and after 10 days of new cases or new symptomatic individuals, recovery testing should be undertaken. For outbreak recovery testing, all staff and residents who have not tested positive in the last 90 days should be tested with a PCR test no earlier than 10 days after the last resident or staff member had a positive result or showed COVID-19 symptoms. If there is no positive PCR test, the health protection teams will advise that outbreak restrictions can be lifted. If there are further positive results, then the health protection team may advise that outbreak restrictions should continue with no further positives are found. And I think we're nearly there.
No questions so far on any of that, Christine, but just to say to everyone, I have popped some summaries of everything in the chat as well.
Brilliant. And just to be aware, we've had questions around who does this testing relate to. So just to be clear, because it's all staff in all the settings that were outlined. So as I'll repeat, care homes, home care, extra care and supported living, adult day care centres, personal assistants, shared lives carers and social workers. The other issue that we've had is questions around settings and non-regulated groups. So just to reiterate, day centres are eligible if they are run by paid care staff. Services must be for adults over 18 and must be provided within non-residential care settings that support health and well-being of adults. And this includes settings such as purpose-built day centres attached to or part of a care home or supported living setting, and other buildings and communities specifically used for regular adult daycare. Personal assistants are eligible if they are directly employed by an individual or self-employed to provide care and support to an adult to enable them to live independently as possible. We have had a question, do personal assistants have access to testing? And yes, they do. This care should include support in the home or to go into the community. Shared lives carers are eligible if they are working with a regulated shared lives scheme. I don't think there's anybody on the call from a shared lives scheme, but that's for people looking after people who are post 18 that still need to be with similar to foster parents. To provide care and support to an adult to enable them to live independently as possible. This includes both carers who live with the person they support and those who live separately. And social workers are eligible if they work with adults requiring support for their health, well-being and social care needs and are regulated by Social Work England.
We have got a question now in the chat, Christine.
Okay.
We've got one from Sarah. Did you want to do questions all at the end?
Yes, can I?
Yeah,
I've just got one last thing to say, and then I'll pick up the question. We have got asked a lot about sickness pay. So to reiterate, there is none. So this is what the National Care Forum have said regarding this. This is obviously a particularly concerning aspect of this new guidance. There is no commensurate additional funding to support the guidance. The Infection Control and Testing Fund is not being extended. The new guidance continues to state that social care workers may have to stay away from work for up to a potential of 14 days if they keep testing positive for COVID. Besides the costs of running the testing processes and the admin processes associated with them, this whole process and mechanism by which the care provider and employers are enabled to pay full sick pay or multiple periods of COVID absence is being called into question. Without that dedicated funds, care providers and employers simply don't have the financial resources to pay full sick pay to their staff who are being asked to isolate in this way. And given that there is a high prevalence of COVID-19 across communities up and down the country, it seems inconceivable that the government would remove the essential funding to support care workers to comply with the new guidance. Being asked to stay away from work and also knowing that full sick pay will not be available to cover that period of absence presents an impossible choice for care workers who are being forced to choose between their well-being and that of their families and those that they provide care and support to. It exacerbates the workforce crisis. So the question is, what's being done? So we're aware that as you're all aware, no other part of society is being forced to make such choices when being asked to live with COVID. So last week, the National Care Forum signed a joint letter with the MHA and the Care Workers Charity on behalf of the not-for-profit sector as well, to the Secretary of State to raise concerns about the government's approach to living with COVID in care settings. And the National Care Forum are also planning to sign a letter coordinated by the Care Workers Charity and the Care Provider Alliance, drawing attention to the plight of care workers more specifically. So just to explain that statement from the National Care Forum, there is a recognition that this is a real concern around the cost of implementing it, and those issues are being raised at a national level. So yes, sorry, Megan, you said there's a question in the chat box.
Oh, yes. So Sarah has a question. She's put, for non-vaccinated or single vaccinated staff, does the guidance stay the same for contacts of case and positive? So for contacts of a case and positive tests themselves. So does it stay the same if you've only had the one vaccine or none?
There's nothing specific that segregates out whether you're vaccinated or not vaccinated within the guidance. And I will just refer to my public health colleagues on that, Irene and Judy, just for confirmation. But I've seen nothing that segregates that. Is that right? Are you there?
I haven't seen anything either. Christine, no, I'm not aware. No.
Thank you, Judy.
We had another question.
Oh, Irene, sorry, Irene.
Oh, sorry, Irene.
Sorry, Nikki did join the call as well, but I think going back to vaccination, again, it's about keeping people safe, and under vaccination, if your staff have not had double vaccinations, are they clinical risk of so it's a personal, keeping your staff safe as well under the vaccination. Encouraging people still to get vaccinated because it's the best protection for your staff. So we would still encourage that for all staff, just for their protection.
Thank you, Irene. And I guess that's the point that you were trying to make, Sarah, wasn't it? I'll bring you in actually, Sarah, but I guess that's the point you're trying to make. You'd risk assess that as a manager, you'd risk assess that, and you would decide whether or not you need to take additional precautions. But also, as Irene says, you would be encouraging them to have the vaccination and so on. Does that answer it, Sarah?
Yeah, Sarah's nodding.
Yeah, brilliant. Thank you. But absolutely, Irene, it is actually that risk assessment as well, isn't it, around that non-vaccinated staff. It doesn't mention it in the guidance, but it is about risk assessing, so it falls within that. Yeah.
Raj had a question. Raj, I'm really sorry. I don't think I quite understand what you're asking there. Did you want to come in, Raj? I think you're saying, is there any restrictions?
I was saying, for this is to ordering the testing kits. Are there any ordering restrictions imposed at all?
You have to apply for those through the portal, and you have to identify the people that you're applying them for. So as it's twice weekly for staff, and the only other the only other test that you would have is for sort of a new person coming into your provision. Apart from that, that's the restriction.
Yeah, that's what we're doing anyway. So I thought sometimes they bring some more elements to it. Yeah.
Not that I'm aware of, Raj. And again, I'll bring my colleagues Irene and Judy in, but I haven't seen anything in terms of
that. I mean, so far I haven't had no problems, so I'm quite happy with it. Yes, the way it's working. Yeah.
Fantastic, Raj. Fantastic. And we've got some hands up as well.
We do. We just had one more question in the chat that came in first from Trina, which was, do we still have to contact temperature checks on staff and residents?
So I was at a meeting the other day, Trina, and basically they were saying you can do that if you wish, if you feel that it's something that you have risk assessed, but you're not required to. It's something that you yourself as an organisation would look at in terms of the risks for your staff and for residents. And Judy and Irene, can I just bring you in there?
Can I say something, Christine? I mean, it also depends what policy, infection policy you have in your care home. So you just carry on unless you go and amend it.
Absolutely, it is. It is. You are responsible for that, and it's your decisions and your policies. So if it is part of that, and you've explained why, then you carry on. But it's all about risk assessing and evidencing it. Yeah, Judy.
Yeah, no, I was just going to agree with that. In fact, if you look at the national guidance, it's never been a mandatory thing to do. It's been something that some health and social care settings have done themselves. Some GP practices do it, for example, some don't. Some care homes have done it, some don't. So it is down to individual homes to risk assess that if they wish to do it, but there's no mandatory requirement to do that, and it's not mentioned in the guidance.
Yeah, thank you, Judy. And the other day on the call that we had some providers that were doing it, some that weren't. So it's very, as you say, like the GP practices as well. So it's very much your decision. And if you wish to continue it and you see that as a reduction of risk, and that's in your policies, and you've an explanation for it, that's fine.
Leon, did you want to come in? You've got your hand up first.
Yes, thank you. I did try and type my question, but I couldn't manage it.
It's all right.
It's all right, Leon. I know how you feel sometimes. It's easier to talk than to keep writing a script.
Yeah, absolutely. Yeah, just first of all, obviously not to say I'm in favour either way, but one of the things, so I speak on behalf of daycare setting, and one of the things our visitors are continuously asking, obviously because communication is such an important thing for them, and the recognition of emotion and facial expression, and it always comes up outside of personal care, so in a normal social activity. Do we have any idea if there will ever be a guidance that enacts the ability for staff not to wear masks in those situations?
There is guidance for day services, and let me just check. I'll check.
I looked through the guidance, and I think it obviously
we talked about it last time. Yeah.
It continuously obviously states if someone has COVID or bodily fluids, but I just get the sense that maybe no one's going to ever say to us, you don't have to wear masks in this situation, and ultimately it could end up being something that someone has to risk assess and decide for themselves. I don't think now is that time, but it would just be nice to know if there is anything, or how we reassure our members who think they're never going to see our faces again.
I think, sorry, if I can come in, if you don't mind.
Yeah, of course.
Yes, great stuff. So I'm Nikki Coburn. I'm an advanced public health officer in the outbreak management team. I think in terms of having that crystal ball at the moment, we're not entirely sure where we're going to go with masks. But again, I think it's referring back to risk assessments again, as to what you feel is most safe for your environment. And totally understand that they'll want that facial recognition. I appreciate, obviously, Irene's also got her hand up as well. But also just one more thing to add, I think more of this may come to light as we move more towards living with COVID as well. So I think a lot more of the guidance will get updated. I've noticed one piece of guidance was updated on the 31st and removed this morning. So it's going swiftly. So yeah, we're all trying to keep up to date with it all. But Irene, did you want to add anything else?
I did take my hand down because you got in and just answered it perfectly. But if you do get onto the webinars, they do say that this guidance is because we're in a high prevalence. Yeah. So all the recommendations is because of our high prevalence, but it will change. They did say that in the webinar. So if you join any of the webinars, this is a lot of the guidance does say we will recommend in high prevalence. We are in a high prevalence. We don't know when that will drop, but there is room for movement and removal of some restrictions when we're not in high prevalence.
That's kind of answered my question, Irene, actually, because that was my fear. Is it like this is now the living with COVID policy, and it's not gonna, if there's going to be continual updates, that's really reassuring, because that's kind of what I was getting at.
That question was raised in the webinar about when to wear masks and not wear masks, and that again, it's risk assessed, and if you're doing personal care or close contacts. But if they did ask if you were in a care home and just not doing any personal care, should we wear a mask? And they said again, in if there's a high prevalence rate, which there is, they would recommend it, but evidence, new evidence will come out.
Brilliant. Thank you.
And Leon, sorry.
No, carry on, Christine.
Just to say, Leon, it's one of the reasons why we have the Q&A sessions, is just to keep you updated with the change, because as you recall, there was lots of queries around testing and isolation, because it was all changing with the general guidance. But obviously social care is different from the general population, health and social care. So we need to keep regularly updating information and being aware of those changes. I noticed, for example, in the professionals visiting guidance, it's in block type at the top, and it says this is due to high prevalence of COVID. This may change. So it is absolutely, as Irene says, it's because we are in high prevalence, although it's actually not defined what that is. It's there in all the it's there in the guidance. They've said we're in high prevalence, and you can't argue with that with the rates, but the definition is not exactly there. Anyway, we should move on. Is that okay, Leon? The chances of us actually communicating without masks, we're hopeful.
Okay, thank you.
Yeah.
Hannah, did you want to come in? You've had your hand up.
Yes, hi, yeah. Just my question is regarding the admission, because we're understanding admission from hospital will be PCR test 72 hours before admission, but it's very unclear coming from community, because there was information we have to test it. We really was not allowed going to people's houses, do assessment. How we did now, we will do test PCR for someone who living outside care home, because if the person was positive, we take the risk bring the virus back to the care home. What is the plan with? It's not very clear. I would like some more clarification how we can testing people from community.
So are you talking in particular about any like living at home, or are you talking about living at home?
Coming to the care home, exactly.
Okay. Oh, okay. So new admissions.
Yeah.
Okay. You're right. I don't think there is clarity in the guidance on how that can take place. I'm not sure whether, again, our public health colleagues can answer that. My question is, would someone being admitted to a hospital have access to a PCR test through their GP surgery, for example? No. Irene's saying no. No.
Well, PCRs will stop very soon, and the only PCRs that will happen within care homes are for outbreak testing. So the home channels for general population will end, and the fixed sites have ended. So you know, going forward, we probably won't be able to test with PCRs. So we have to work around this one. It'll probably be LFDs. So the within the guidance, and it was mentioned on the webinar, that this has now been handed over to care homes to do their own testing for new admissions.
That's the point, Irene.
Exactly.
The guidance, yeah, it doesn't exactly say how the home can do that.
You may have to have support from family members, you know, to help.
Public is not allowed to doing PCR tests, so we are
doing PCR tests. There probably won't be any PCR tests within the community very soon, so this will be just LFDs.
Yeah, because instructions said we have to do PCR before admit someone, but now we speak about LFD, so it's no really. They said must be 72 hours PCR before admission, LFT on the day admission. But the problem, how I got admission next week, how I get it, the PCR test for person coming to the care home.
So within the guidance, it does say that you will get extra supply of LFDs for new admissions to support with that. They haven't gone into the detail of how how that would happen, but it will be more moving over to LFDs rather than PCRs, and whether this is going to be done with support of social workers, family members, or somebody already that's done the assessment in their house to say that they need to be transferred, but it will be probably a shared task between community and yourselves to do this test. It does say if a test cannot be performed, that the person can still be admitted with an LFD on arrival with isolation, depending on if it's positive or not. So there is ways around it if you, but if you join the webinar, the link is available. They do answer that question, or they did raise that question. It's not going to be straightforward to begin with, as we know, with all changing guidance, but I think it's just trying to use LFDs and seeing if there was anyone within this person's house that's, you know, that could do an LFD and then doing another one on the day.
Yeah, so that would be way, but instruction is using PCR. So what's point put something in place, a request provide by home PCR test and tell us, no, you're not do LFT, because on the end, we know really follow the rule at the moment if we do LFT.
So you have PCRs within the care home for outbreak testing. So you have PCRs, so you could use that one, but it does mean that you would need to go to the person's home to do that and then post it back through your own channel or courier. There is options there. It's just what's the easiest option or best option to keep your residents safe.
Because you see, if we just, we can't send to the family box of test, we will testing, we register. But if we register on our company and appear positive, we got outbreak because we got positive case and before coming to the care home. So using our test, we have to register. So I think it's a lot confusion with this admission from outside for me at the moment.
Have you got any fast tracking PCRs kept in your homes that you can use it for each resident when they're admitted? Because we use that if we don't have to.
Yeah, but if you will be positive, you will be registered positive, someone who's not in the care home, and you got positive case before someone coming to the care home.
Yeah, but
that's the problem. You don't want to register for some.
We have to risk that assessment because now people from community will be allowed to be admitted into the care homes. That is the guidance going to be, but we have to risk assess them whether we can manage them or not.
Can I just intervene here? Can I just intervene, ladies? Tim Weller has really helpfully put something in the chat box, because I'm busy looking at the guidance to see what's happening, and you've definitely highlighted something here. So the guidance on testing for admission to a care home from the community was withdrawn on the 4th of April. That's, I think you were talking, Nicola, about that, with no apparent replacement. So does recognise the dilemma Hannah is validly setting out. So Tim says he'll escalate this to the regional partners at the Department of Health and Social Care to request a specific guidance solution. Tim, did you want to come in? Are you there? I didn't see you come in. You crept in.
Sorry, Christine. I crept in late. I was hoping you wouldn't notice, but I felt need to come in there because I.
Oh, you've just frozen, Tim.
Yeah, you've frozen there, Tim.
Oh.
Bad signal in the shed.
Yeah.
We'll see if we can get Tim back. Shall we?
Yeah.
But yeah, thank you, Hannah, and we can
so
obviously
much.
be in touch as well. That's all right. We did have another question. Just keen, obviously, on time to get through because we've had quite a few in the chat. Which Kay has said.
Oh.
Are you back, Tim?
I'm back. Yeah,
Oh,
I was away for a long time. I feel like I've probably missed loads, but thank you, Raj. But sorry, what I was saying was that I've been off for 2 weeks. I'm really here to help myself catch up with because a lot has happened in the last 2 weeks. Hasn't it? They say that a day in politics is a long time, but goodness me, 2 weeks in health and social care is an absolute eon. So a lot has changed. But what I have caught up with is that guidance is out because you know the admissions it's been because it's been withdrawn. I think that's presented providers making admissions over the last couple of days with exactly the quandary that Hannah's pointed out there, and I can't really find any guidance that gives a solution to specifically the question she's asking, which is absolutely valid. So I've during this meeting I've been emailing relevant colleagues at Department of Health to get a solution to that, because it's leaving providers in a vulnerable situation, knowing what they should really be doing. I mean, you know, Irene's articulated the ways of going around it to be able to try to solve it, but really that's, which is fine, and that's good, but really providers want to be able to point to something to say, this is what I'm doing because this is what I'm told nationally is the position, rather than workarounds, which isn't really a very satisfactory way of doing things. So we'll see how quickly we can get a response to that.
Thank you. Irene.
Could I just add in that we still have the rapid response team. They're still commissioned to do these swabs, and they will continue till the guidelines are sorted. But I just wanted you to make aware that there will be no PCRs within the community or GPs to do it. So that option will be gone because those channels are gone. But the rapid response team are still available till the guidance is updated.
Until the guidance is updated, yeah, absolutely, Irene. And just as Tim's pointing out, and Hannah, that actually it says in the guidance PCR, it doesn't give an option of LFD, it says PCR. So until that's changed, until that's clarified, it causes these issues, doesn't it? I can understand what's going to happen in the future, absolutely, but we're in the here and now. So it's good that that's being reported back to the DHSC. Thanks, Tim. That's brilliant.
Our next question was from Kay, and they've put, are masks still compulsory if there are no COVID cases?
I'll bring in my health colleagues here.
Oh, that's masks for staff. Sorry, a mask for staff compulsory.
Yeah.
Sorry, can you repeat the question, Megan? Sorry.
Yeah, that's all right. It's, are masks for staff compulsory if there are no COVID cases?
Absolutely, yes.
Yeah.
It goes back
compulsory.
to the previous conversation about, you know, we are seeing incredibly high community prevalence, and that may change. And I know that, as Irene has already alluded, that it's under constant review, but currently, absolutely, yes, to protect staff and residents.
Yeah, and it is in the guidance as well that we discussed earlier, which is about staff wearing masks and the type of masks that they're doing for the type of task that they're doing. So if you want to look at the recording later and go back, it tells you the masks that you're meant to wear, but also it's in the guidance. So just to explain that. Did you have your hand up again, Judy? Sorry.
Yeah, just on that note about masks, can I also just remind everybody, because of the high community prevalence at the moment, still be very cautious when taking breaks, when masks are not worn. There's still the expectation that you try and keep 2 meters in a well ventilated area, and smoking breaks and things like that. I know it's difficult because outside of work you can socialise and go out for a meal together, but that still is a requirement in social care and healthcare as well. So just a reminder really for staff to try and reduce onward transmission and prevent outbreaks.
Lovely, thank you. Thank you.
Ian, was it this point you wanted to come in on?
Yes, if I can. Yeah, hiya. I've just put in the chat. I was on a webinar a couple of months ago with a company that has actually got IR masks. We've actually got a clear plastic panel in them to actually help with communication. These are CE kite marked as well at the moment. So I've also put in there the web address, so you can actually request samples from the company to try them out in the home, so you get on with them. Because I know if you're having problems with communication because you've got the blue masks on, these will actually allow the residents to actually see your faces a bit clearer.
Thank you, Ian. And I presume Judy and Irene and so on, they're all acceptable in terms of protection?
I'm waiting to see the guidance on that actually, but if they're CE kite marked, I think we're waiting for the final documentation to say that they're past the test. I'll have a look at them. Yeah.
Thanks, Judy, because I'm aware that they've been around for a while now, but I wasn't aware that anything had changed in terms of agreeing that they are suitable to undertake certain tasks with. So yeah, that would be very helpful because that needs clarification, doesn't it? Thank you.
The next ones, we've actually got quite a few. So Veronica, Jane and Pat have all asked about the sick pay stopping. And have asked, do staff still qualify for statutory sick pay? And Jane's then said, going back to paying staff to isolate, statutory sick pay only kicks in on day 4, and we would normally expect that after 7 days, the member of staff will need a doctor's certificate to still access statutory sick pay. Are we expecting positive staff to have to get a doctor's certificate or still access statutory sick pay? Lots of S's in that sentence.
Yes.
And Veronica has expressed obviously the concern about the support for sick pay stopping as well.
Yeah, in terms of sick pay, as I say, there's before it used to be supported through funding through the Department of Health and Social Care, and there were changes, weren't there, to statutory sick pay brought in. They've all been removed, so it's back to how it was before. There is no support, and that's the reason I read that statement from the National Care Forum, which is, you know, the sustainability of this is what's in question, because you are operating differently to everybody else in the community, and therefore you are incurring costs that the rest of the community would not. So another business would not incur the same sorts of costs. So all I can say is this is going back, this is a live issue that is being debated currently between campaigning groups, local authorities, care associations and the Department of Health and Social Care. That's all I've got to add, unless anybody else on the call has got anything else to say.
Nothing at the moment.
No, it is an issue. It's been raised. It's a really tricky one at the moment, and it's going to cost a lot of money, and that's the reason why it's such a live issue.
We've got Raj, it's probably one for Irene or Judy, and he's asked, are there any updates to LAMP self-testing rollout?
Oh, I definitely know Irene will know this. Irene.
LAMP has now stopped, so we're not using LAMP anymore within the system. So DHSC has stopped funding of LAMP. So any of our plans for rollout further to social care has stopped due to funding, and all NHS staff testing, they've all transitioned over to LFDs.
Oh, thank you for the update, Irene. That's really helpful, because obviously there's different gaps, isn't there, with LAMP to LFD? So it's really helpful to know that that's changed. Thank you.
Pat's question was, are we still expected to provide LFTs to all care home visitors, excluding professionals? So these are visitors obviously coming in to visit loved ones.
So again, that's covered in the guidance. The only testing that needs to take place for visitors is those that are involved in personal care. So they would be treated as part of the staff. Other than that, there is no testing required for visitors in the guidance.
They did say that if you have visiting professionals such as a hairdresser or someone that's doing close contact, they're the ones that might need a test as well, because they won't be able to get it as general population. But any other NHS visitors should be testing as part of their own testing regime. But any visitors that are not doing personal contact, like plumbers or maintenance, do not need to be tested.
Yeah, absolutely. There are issues around professionals and anyone involved in personal care where the recommendation is that the testing still continues. Can I just check, in terms of visitors, who was that asked? Sorry, I'm just going up here. Who was asking about that?
That was Pat that asked for that.
Pat, were you talking about visitors as in family and friends, or were you talking about professional visitors? Sorry.
They did put in brackets excluding professionals in their question.
Exclude. Sorry, that's why I answered it as I did, because Irene's absolutely right. There are different guidance for professionals and other visitors, but if it's family and friends, there is no testing required now unless they are going to undertake personal care.
Lovely.
Oh, thanks, Pat. Yeah, that's what I thought, but yeah, thank you.
Veronica's got a question, and I think this relates to those being discharged from hospital to their own homes. So she has put, can hospitals discharge COVID positive patients to their own homes, and do they have to inform providers that they are doing this? So Veronica, is that in terms of home care providers? So would they need, is that what you're asking?
Yes, Megan, that is.
Okay, Veronica. So you're saying, so do you want to come in, Veronica, and just explain? So I presume you're talking. Yeah, thanks, Veronica. I presume you're talking about somebody that's being discharged from hospital coming back into the community, and you're going to then supply a home care service. Yes. Is that right?
Do the hospital staff to inform us that they are COVID positive? Because previously we've said that we had to have a negative COVID test before we allowed them back home. But obviously, as guidelines are constantly changing, is that still the case that they have to have a negative test before they come home, or can they still be discharged positive?
That's a very good point. I'm looking at the guidance to see if I can see anything. I don't know whether my colleagues there from Public Health, or Irene or Judy, you could answer that.
It's a good question. I'd need to look at the guidance too, Christine. I'd like. Yeah, sorry. I
So a ball curve there.
Yeah, no, but you've got a very good point. Because it talks obviously of discharge from hospital into a care home, but I can't see discharge of hospital into the community. A very good question, and we will take
Nicola,
that
are you Nicola, I think, is still on the call from Public Health. Did you know at all, Nicola?
I'm just having a quick skim over it at the moment, so I'm just I'm just having a quick look. Yeah, I've got it's the admission of care home residents to a care facility, community. So yeah, hospital to community. I'm not sure at the moment. I don't think that's in there.
I don't think it is either. I can't find it, but you know, it's difficult when you're managing this and trying to look at the same time. It's difficult. But what we'll do is we will clarify that for you and get back
Yes,
to you on
please.
that. Is that okay, Veronica?
Yeah,
You've
thank
asked
you.
you've challenged the experts here.
Oh dear, sorry.
No,
It's
it's
all right.
Oh,
Thank
Judy.
you.
Yeah, what I would add is though, Veronica, is that you treat all patients coming out of hospital, potentially, well, everyone that you're dealing with, you know, that's why we call them standard precautions. You treat everyone as if they, you know, take the IPC precautions and wear the PPE to the level that somebody is positive, because unfortunately, because we've got such high community prevalence, we are seeing a lot of cases in hospital that are, we are still doing the day 0, day 3, day 5 to 7 testing. We're getting an awful lot of asymptomatic positives. Some of them positives might come up after someone's been discharged, and the hospital, if that person's in a care home, then you will get a phone call, but they might not know that that person had a package of care and has social care in. So just be extra vigilant and just treat everybody as if they potentially, you know, then if you find out later that they were, you've done the right thing. You're not classed as a contact because you've worn the right appropriate PPE and taken the right measures.
I mean, we haven't come across it yet, but what is the situation? Say if we had a service user that tested positive, obviously we have lots of vulnerable people that we look after. Are we allowed to say that they have to isolate and we can't provide care, or do we go in as normal? What would be the procedure?
I mean, I don't know. I mean, the guidance now says for transfer to a care home that they can accept it if they feel that's safe. So I guess it would be that conversation if you feel that you could manage that, where they were in their isolation period.
Carers, obviously in home care, carers have the choice if they're willing to go into a service user, the same as the service user has a choice whether they're willing to allow any particular carer. So if we ever got to the stage where carers, if we had, say, a positive service user and carers refused to go in, where would we stand?
I don't know, and that's something else we can find out while we're looking at this. But I can put I'll put our generic email in the chat, and we're also, you know, if you're in that situation, we're happy to work through with you. You know, the best way that you could manage it. Yeah. Okay.
Lovely. Thank you. Appreciate it.
I think that's a really important point as well, Judy, to make, isn't it? That if people do have these issues, that's what you're there to support as well. So it's often, you know, when you're in the community, where do I go to seek support and help? So it's really, really good to remind people that they can contact you if they have issues around those sorts of concerns around infection and control and measurements that they need to take. So thank you, Judy, and hopefully again we'll make sure that everybody on the call receives that email so that they can remind themselves as well that they can contact your team for support. Judy, can I just clarify that email? Is that from Monday to Friday? Is there another email for the weekend? Because I understand there's an Eastern region. Is that right?
So we're the CCG. So no, we're Monday to Friday 9 to 5. EC and NCH&C. So EC will have their own on-call service where they provide a support service for care homes, and NCH&C, but they're usually then directed through UKHSA. So if there was an urgent problem at a weekend, I'd probably say to care homes, go through UKHSA. They then know how to contact the on-call community nurses that would be able to help from infection prevention and control.
We did make sure that that link was put in one of the communications out to the care sector. I think, Tim, I think you might remember when we sat in comms and we identified it. So in one of the letters, it's there. We'll have to seek it out and make sure everybody's got access to that, because it's not just care homes, it's dom care, it's supported living, it's anybody that works in the community that needs this support. So that would be really helpful. So thanks, Judy, because the weekends are often the time with the least support, and you know, people do need to know where to go if they do need that support. But thank you, that's really helpful. Yeah, we were talking about what? Sorry, Megan. Do you
no, I was just going to say I'm up to date, I think, on the questions now. So it's just anything else that comes in and any hands that come up.
I did notice. Was it somebody talking about accepting, was that Veronica around accepting a positive person into the community?
I think that's Andrea responding to Veronica there.
Oh, okay. Okay.
Am I right, Andrea? Is that what you're saying there?
Absolutely. As part of NFS, we do accept hospital discharge for COVID positive into the community. Yeah, just risk assess and PPE.
Thank you, Andrea. That's really helpful as well, and it does make sense as well, doesn't it? And exactly as Judy's outlined, you have to if you've got no other information either, is to treat everybody as if and just be very cautious, particularly in high prevalence. Yes. Oh, yes. Thank you, Tim, as well. If staff refuse to provide a service to a positive person funded by NCC, then call NCC and your quality monitoring officer would be there to help. We've managed several of these. Yeah, thank you, Tim. And again, it's where to go, isn't it? So that's really helpful to be able to signpost and direct people for support. And sorry, I should have realised and said that earlier myself. So thank you, Tim, for reminding us.
Nicola, you had your hand up. Did you want to come in?
Yeah, I just wanted to share something. I can see that there's an update from UKHSA just to say that they have stood down the out of hours. So they are working Monday to Friday 9 to 5. This was an update from a few weeks ago. I'm not sure if it's made its way to you guys. So it will be dealt routines, COVID-19 inquiries and outbreaks notified to the health protection team out of hours, including bank holidays from care homes and other vulnerable settings, will be responded to the next working day. Queries regarding COVID-19 from partner agencies, including local authorities, will also be responded to the next working day. And this will bring the COVID-19 response in line with the out of hours arrangements for other non-urgent communicable infections and hazards, which has not changed. Just to make everyone aware.
So basically, there's nothing at the weekend.
I think we're moving more towards the living with COVID.
In a high prevalence situation. Okay.
So just an update from UKHSA there for you all.
Yeah, thank you.
Thanks, Nicola.
Thank you. Okay. Right. So sorry, guys, there's not very much positive in that respect. I don't know whether we can move. Is there anything else to move on? Just Nicola, just to bring you back in, was there anything that you wanted to, because I'm aware that there were some flyers being discussed at one stage. Was there anything else from the public health perspective locally that you wanted to get across at all to providers at this stage?
Not at this stage that I'm aware of. I can check in with colleagues to see if there's any movement on that, and then I can come back to you.
Yeah, thank you, Nicola.
Sure.
That would be really helpful. Just in case there's any particular messaging or anything like that. Obviously, through the CCG, there's that joint communication. But I do recognise that public health also provide messaging as well. So if there was anything specific that everybody needs to be aware, then yeah, that's fine too.
Brill, cool. Thank you, Christine.
That's okay. Thank you, Nicola. Thank you. Is there anything else? Anybody else has got any other questions? Remember, no questions are silly questions. Please do ask. If not, I think we'll leave it as it is. Obviously, Irene mentioned the webinar that took place. Was it yesterday, Irene, or the day before? I've lost track of my days. I think there are some more. We advertise them in our e-bulletin. So they're useful to go on. And as soon as we've got a copy of them, we'll circulate that as well to everybody, which will supplement. But just kind of a word of advice. Always remember the date that you look at the information and just check the updated guidance because it does change regularly. Irene, did you want to come in?
No, I was. Somebody has put in the chat. Andrea, there's another one today for home.
Oh, Andrea, yeah, for home care. Yeah.
The link
Brilliant.
yesterday didn't work, so a lot of people didn't get in. So they updated the link for the webinar yesterday. So just make sure you use the new link.
Brilliant. Brilliant. Yes, I heard all about it. There was a lot of chat going on about how it all collapsed, etc. But it was all sorted in the end. But yeah, thank you, Irene. And there are a few more taking place. So any that we get once they're recorded, we'll always put those up as well. But as I say, just be mindful of the date the recording takes place, because guidance does go out of date quite quickly. Okay, so thank you all very, very much for your attendance. I hope you found it useful. We'll have the recording. We'll have some information to go out. We'll take back the questions that we've got. Veronica, we'll take back your question and make sure we try and get an answer. But thank you very much.
Appreciate it.
Thank you. And thank you, Irene and Judy and Nicola and Tim for attending too. Really helpful. Thank you.